States. Now, the National Public Health Emergency Team is looking for more time before restrictions are eased further. The Cabinet COVID Subcommittee is due to meet today to discuss the recommendations from NPHET. On the line is Professor of Health Systems at DCU, Anthony Staines. Anthony, we've 84% of over 16s now vaccinated. Do you think we need more time, or can we move on now?
I think what's going to happen now is a significant rise in cases in children, and we've seen a number of countries where this has happened. We've seen Israel, for example, which has similar levels of vaccination to ourselves, where there's been major outbreaks of COVID in younger people in particular. In older people, there are still many cases, but the majority of these cases do not end up in hospital. But enough of them, if there are enough cases, enough people fall ill, and enough people die to cause really quite serious health problems. So when we get to 90% of the whole population, we can maybe have other conversations. But at the moment, that's what will happen. Now, the government spokesmen are quoted in the media last night as saying that these cases are priced in, that the cases have been well flagged, that it's well understood that case numbers will rise, hospitalizations will rise. And their view is clearly that there's an acceptable number. And that is a political decision, not a technical decision. It's a decision for the government. I would be more cautious than the government because I think this could get out of control faster than they expect and could cause more problems. But we have decided, for the moment at least, that we're going to allow a fairly dangerous respiratory virus to become endemic, to become effectively a normal part of everyday life. But I'm not sure that people have really understood what the consequences of that choice are going to be for the next few years.
But what are those consequences, Anthony? I mean, children don't get the disease that badly.
Enough children get sick enough with this to cause significant problems. Children, when they get this, are typically quite sick for several days, to the point at which they need to be minded, which is something familiar, say, from diseases like chickenpox, which is now much less common than it was, and diseases like measles, which is effectively vaccine preventable. A small proportion of children and a small proportion of vaccinated adults fall ill, end up in hospital, and some of them unfortunately die. Now, these rates are very low in children, but they're not zero. And our health system struggles, as you will know, every winter to cope with influenza. This is considerably worse than influenza. And this is a decision that many governments in Europe have taken, and not just our government, that they're going to allow this virus to become a normal part of everyday life. But I'm not sure they've thought through the costs of that. Influenza is very expensive. It costs a great deal of money to the country, to the economy, the population, and the health service. It's likely that COVID-19 will be substantially worse than influenza. And the consequences in other countries have been dire. We see many parts of the world where vaccination is not yet available, where death rates are still extremely high. The severity of cases is very high.
You're painting a very doomsday scenario there, Anthony. I mean, we have 61 people receiving treatment in intensive care. That's far below what it was at the peak of the pandemic.
Oh, it is. And the vaccination has changed the outlook completely. But 61 people in intensive care is still, a sixth of our intensive care capacity. That's not... That could well become a regular feature of life. And that's, it's a political decision to take that choice. The job of people like me is to say this is what we think will probably happen. So we think that there will be substantial numbers of cases in schools. I hope we're wrong, by the way. We would urge the government to do everything they can to reduce risks. And part of reducing risks is to bring in public health capacity to control outbreaks, because we haven't got that at the moment. The tracking and tracing system has effectively stopped doing anything very much.
Schools have protocols in place and have had them in place since students went back, and we have a situation where they have CO2 monitors now as well.
CO2 monitors don't help. The government's advice to schools is quite specific. If your CO2 monitor shows that you can't ventilate a room properly, talk to an engineer. and come back to the Department of Education with a proposal to do something about it, which will take many months. In other countries, the advice has been, here is an air filtration unit, here are clear, simple instructions for using it, place it in the relevant classrooms and turn it on. And these are devices around the size of a kitchen chair, costing a couple of €100. The Americans estimate that they can really clean the air in all their schools for roughly $10 per child per year. But our government seems to be unwilling to steer schools in that direction and unwilling to make the fairly modest investment involved. So we are allowing schools back, but we're not putting in place everything we can to mitigate risk. We're opening up our society, but we're not putting in place everything we can to mitigate risk while opening society.
Professor Anthony Staines, thank you for joining me this morning. We'll have to leave it there. Time is against us.